Ladies and gentlemen, good evening. It's my hope you have had a very fantastic week and you are in good health as we approach the weekend. Let me start by thanking you people for the support you have been showing me throughout this since I started this channel. I do appreciate for your subscriptions. I appreciate for your likes. I appreciate for everything and the topics you have been bringing about for us to discuss. And I hope our discussions have been of satisfaction to your needs. So let's continue subscribing, sharing, and commenting our videos so that they may reach as many people as possible. And I hope they are helping your sister, your brother, or your relative somewhere. So today we are going to tackle another very important topic which many people have been requesting that we discuss. So today we are discussing about what we call fibrocystic breast disease, or you might call it fibrocystic breasts, or you might call it fibrocystic change, or you might call it breast fibroid. All those names refer to just the same thing. So this is a benign, or fibrocystic breast disease is a benign non-cancerous condition which the breasts, or whereby the breast feels lumpy. It's a condition whereby the breast feels lumpy. Lumpy means when you palpate the breast, you will feel inflammations or swellings like lumps. Note this, fibrocystic breast disease is not harmful or dangerous. It's not harmful or dangerous, but may be bothersome or uncomfortable for some women. It's not always dangerous, but it may be bothersome or uncomfortable to some women. Fibrocystic breasts may be asymptomatic, or we can put it this way, many, more than half of women who get this kind of a disease will develop no symptoms for this kind of a disease. So you may be having the lumps, but there may be no symptoms to show whether you are having this kind of disease. And every woman, or more than half of the population, you will find that in your life, at a certain point of your life, you have to develop this kind of disease, but there might be no symptoms associated. So when it gets to the latter stages, or when the condition worsens, what symptoms will the patient present with? Or what are the symptoms of this fibrocystic breast disease or breast fibroids? One, we have obviously a swelling or the lump. Number two, we have tenderness. If you try to palpate the lump, it feels a bit hard. That's what we call tenderness. We have pain. Obviously, where there is an inflammation, the nerves are compromised and there must be pain. Next, we have thickening of tissue. The tissue around that area, the inflamed area, obviously it will increase in size. or thicken. Next, lumps in one or both breasts. So this condition may affect one or both breasts. So if it's in one breast, the lumps will be felt in the affected breast. But if it's in both breasts, both will have the lumps. A point to note, your symptoms or these symptoms probably get worse right before your menstrual cycle or before your period due to hormonal changes, but you may have symptoms throughout the month. You may be having some of these symptoms throughout the month, but they get worse some days before you start your menstrual cycle. I hope you get that. So, lumps in fibrocystic breasts tend to fluctuate in size throughout the month. So they may increase in size or decrease in size depending on your hormones, as all these functions are controlled by hormones. So the lumps tend to fluctuate in size throughout the month and are usually movable. They are movable. If you push it, it may seem to move. They are usually movable, but can also be fixed in one place if there is a lot of fibrous tissue. You may have pain under the arms. Pain under the arms. Some women have a green or dark brown discharge from the nipples. Pain may be under the arms, but also some women may be having a green or dark brown discharge from the nipples. Note this, you should see your doctor if clear, red or bloody fluid comes out of your nipples, as this may be a sign of cancer. So if you see a red or bloody fluid coming out of your nipples, this may be a sign of cancer. So you should see your healthcare provider or your doctor. What are the causes of fibrocystic disease? Breast tissue changes in response to hormones made by ovaries. This is one of the causes. Breast tissue changes in response to hormones produced by the ovaries. If you have fibrocystic breasts, you may have more pronounced changes in response to these hormones, and this can result in swelling and tenderness and painful lumps. I want you to get this. If you have fibrocystic breasts, you may have more pronounced changes in response to these hormones, and this can result in swelling and tender and painful lumps. You may develop lumps in your breasts caused by cysts and swelling of your breast lobule or milk producing glands. You may develop lumps in your breasts caused by cysts. A cyst is just an inflammation caused by cysts and swelling of your breast lobule or milk producing glands. You may also feel a lumpy thickening in your breast caused by an excess growth of fibrous tissue. This marks the end of our first video about fibrocystic breast disease. So guys, continue subscribing, continue keeping the support on. Let's meet in the next video.